Hi, and welcome to the show. Rate and review at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today in the show, we have Vince Baiera. He's a nurse and healthcare executive. His Kevin MD article is titled, Care Coordination for Obstetrics Teams is Crucial. Vince, welcome to the show.
Yeah, thanks for having me.
We'll get into the article in a little bit, but first off, briefly share your story and journey to where you are today.
Yeah, well, I started my career as an ICU nurse at the Cleveland Clinic, then Duke University Hospital, moved around, did travel nursing, taught at the college level, and then moved to the business side of healthcare. From there, I've worked with a large e-learning company, among other tech providers, and even having my own small business. Really, for me, the focus over the years is trying to do things where I can have a bigger impact and reach more people. And between my day job work and my side business, I'm able to do both, and really allows me to reach a lot of folks. And that's what really fills me up over time. I've learned is just doing things to try to impact others. So it's been a fun journey. I've moved around a lot. I now reside down in San Diego, and lucky to get to call this place home.
So tell me about that transition onto the business side, because you mentioned that you were an ICU nurse, and actually, I don't talk to a lot of nurses who have that business side to them. So tell me a little about that transition.
Well, it was hard. You go from making a darn good wage as an ICU traveling nurse to starting at the bottom and trying to, earn your keep and build your chops as a sales professional. But was lucky to work with a strong organization to teach some of those initial sales skills. Really pride myself on being a self-taught entrepreneur who built a business that's done almost $10 million in sales. And so all of that culmination has really continued to groom and drive me to be, kind of the person I am today. And again, I take a lot of pride in that craft and building that craft because in nursing, it's such a focused discipline. But then as you move to business, it really opens up and you can kind of go in any direction you want. And so all of those things together have been really fun for me. And as much as I love nursing and love the people and a lot of the things that are offered, I could sit and talk business stuff all day. So I just really love that aspect of kind of where my journey's brought me and what new doors will I think will continue to open for me.
Now, did you have any business mentors that can help guide you, or completely self-taught and trial and error?
The beauty of today is you can find a mentor online anywhere, right? Everybody's putting out content, but I certainly had a few folks individually that were big and influential for me, taught me some of the basics, helped me avoid some roadblocks, and in short, just again continued to push me and really inspire me to push myself. So yeah, I've had a few very close mentors, but then a lot of mentors from afar. And I know everybody on here who's pursuing things are probably investing in themselves and reading a lot, but it always amazes me how many people don't. When somebody will take their whole life's learning, condense it into 200 pages and give it to you for about $15 if you'll just read the content. And, I, again, really pride myself on trying to consume and learn quite a bit along the way. So that for me has been really the driving force in propelling myself to where I am.
Now, for those healthcare professionals who are interested in making a similar transition into the entrepreneurial business world, what's the single biggest piece of advice that you could share with them?
Learn how to sell. Take a sales course, read sales books, get involved, whether it's a sales organization. And even I found network marketing, although sometimes has kind of a dirty connotation, it also provides you the framework to have somebody personally invested in teaching you a lot of the basic skills you need to get started, how to set a meeting, how to give a presentation, how to follow up. And they're invested to help you grow because it helps them. And so again, that was something I did for a few years. Wasn't ultimately where I felt like I would get the most fulfillment and success, so I moved on. But it was certainly crucial early on in my days to learn some of those basic skills. So selling, it's going to help you get a better job. It's going to help you climb the ladder. It's going to help you sell your idea. It's going to help you sell products to customers. So there's a lot that you can really take away from building those chops.
All right. Your Kevin MD article is titled, Care Coordination for Obstetrics Teams is Crucial. Now tell us, how did this article come together?
My wife and I found out she was pregnant in 2021 around the summertime, and 14 weeks, her water broke. She was pregnant with twins. And once we found out that indeed her water had broken, we were devastated. But they gave us a few options on how to proceed. And because both boys still had a heart rate, we decided let's just wait and see. Worst comes to worst, one of them demises and the other boy she can continue to carry. But over time, that boy just never let go. He never gave up. And then both boys ended up surviving. And she carried those boys from 14 weeks to 34 weeks, which is very rare. And it garnered a lot of attention, not only from the hospital, but also others who wanted to kind of share that story. And so over time, the birthing process unfolded. We had a successful outcome, which again, we can talk more about some of the ins and outs there. But after the fact, it really, again, was such a blessing. And it was, I believe, something powerful that people could relate to and really gravitate to, because so many individuals have issues during the pregnancy and you don't really hear about them until you go through them and someone goes, oh, my sister had this, my cousin, this happened, et cetera, et cetera. So when you're in it, you get a lot of that support, but it's a little bit taboo. It's not always talked about because it's so painful when you go through a loss. And so with that, as our outcome unfolded, the story got picked up, and it was something that I believe was intriguing enough for you to pick it up, because again, it just tells the story of something that doesn't quite happen all that often. So that's how the piece came together. It was certainly a rocky road, and we had a lot of ups and downs, but so thankful for where we are now.
So tell me about your interactions with the healthcare system during that time.
As I worked for 7+ years as an ICU nurse, working night shift, 12-hour shifts, I got very comfortable and familiar with how a hospital works. I got very comfortable going to the hospital every single day. So when this happened and we were in that groove with my wife on bed rest for 5 months, 3 of which in the hospital, it was a little bit less scary because I knew what to expect in a sense. But as you get into the hospital, each floor, of course, works different, and the flow, the staff, the interactions, the daily treatment, it's so crucial to keep ahead of, as we all know in healthcare, to really identify those issues early on before they balloon into something big that you can't really quite treat with, say, a small medication or things like that. So the care coordination was vital. And the floor that we were on was, they did an amazing job. Really great leadership from the rounding physicians, really great care day in, day out by the nursing staff, and even the ancillary staff all played a part in keeping the environment in a very cohesive and healthy way to allow us to really focus on what we needed to do. And I told my wife that all the time. I said, just focus on the things that you can control. I'll focus on some of the other stuff that's, outward facing, and we'll try our best to get through this. So again, that coordination is just crucial to allow the patient and their family to relax, to breathe, to calm down, right? We know how important those are to outcomes. So yeah, we were lucky. We were at one of the, I believe it's the #1 hospital in California for number of deliveries. They do about 8,000 deliveries a day. And it was, again, a really good experience.
Now, you mentioned your wife was in bed rest for about 5 months at this hospital, and the outcome certainly was less than certain. What would be a typical day like? Just describe and take my audience through a typical day during that time.
Bed rest for 5 months, 3 of those at the hospital. So the first 2 at home. But the normal day, we always laugh. People think it's so restful and peaceful and you might get bored. No. From morning starts to evening finish, you've got nurses, you've got your staff coming in to do their morning checks, to get you your morning meds. You've got people coming in to clean the room. You've got doctors rounding. Of course, we want to get outside to get a little fresh air, so we'd always try and sneak an outside, wheelchair session in when we could. But it was just back to back to back. And I remember, we had this misconception that it would be very slow and there'd be a lot of downtime, but there wasn't. And I don't know how it is on other floors. Again, I've worked in hospitals for a long time, but for us, it was just one thing after the other, starting from the morning. And so there wasn't a lot of downtime, but enough for us to continue to just let her sit and gestate, as we would say.
You mentioned earlier that it was critical to stop problems early on in order to prevent them from blossoming into something big. What would be examples of some of those issues?
Well, they would do the fetal heart monitoring and they would try to look for occurrences where the fetal heart rate would rise or lower and just watch and see what that was doing. And if it happened so many times over an hour span, then it would start to indicate to them that you may be starting to have contractions. And if those contractions are frequent and severe enough, specifically causing pain, then they would start certain medications to try to get your body to stop contracting. What was crazy, we didn't realize is, my wife would have these little feelings. Those were contractions. She was contracting for months and months every single day. But one clarifying thing that we learned was they would ask her, "Are you having contractions?" And she would say, "Yes." But what they meant to ask was, "Are you feeling painful contractions?" Because if they're not painful, they're not worried. And indeed, we didn't learn that till, say, the last month. That's what they actually meant. So we were saying yes to contractions. They would sometimes start to get worried when in actuality, we weren't communicating clearly. So again, my wife's a dentist, even with her level of knowledge, my level of knowledge, and how smart the nursing staff was, there was still room for error with miscommunication. And again, just simple, small things that sometimes can lead to treatment and calling physicians and getting orders and all the things that we know happen to continue to try to prevent some of those long-term, issues.
Now, as part of your story, you mentioned that you were a travel nurse, and I assume that you've seen a variety of medical institutions and healthcare settings. Would you say that the care coordination that your wife received, would you say that's typical of all the healthcare settings that you've seen?
I think that it was typical. I think that on a scale of 1 to 10 of excellent versus 0 being poor, I would say they were around like an 8.5, 9. They did a very good job. There's always room, we're always thinking there's room for improvement. So could it be better? Of course. But as a whole, they did a very good job. And I would say it is typical. But again, being that Sharp Mary Birch Hospital is a very well-known hospital, again, affiliated with Rady's Children's, which is a top hospital here in San Diego, they do a darn good job. So I would say it was up in that 8, 9 range in terms of efficiency, effectiveness, things like that.
Now, for all those healthcare professionals who are listening to you on this podcast, it could be clinicians, nurses, support staff. I just want to emphasize, what are the things that they did during this experience that stood out to you the most in terms of making the most impact?
From my days as a nurse, I think the people who had the best attitude, the best gumption, the most enthusiasm for recovery were the ones that would ultimately have the best outcomes. And I took care of patients with open heart surgery for years and years, and people who were really close to, unfortunately, not making it. And I think what this hospital staff did really well was keep your enthusiasm up. They were very positive. They all had sayings on the back of their sweaters that says, "We grow miracle babies." And in our situation, there's very little data. There's very little information about a woman with twins who has a premature, previable rupture of the membranes that ultimately carries a child for 20 weeks and then has an outcome. I mean, the physicians there they range, right? The group, I think, had 9 physicians in the group. And it was one were very, their outlook, I don't want to say was dire, but they would be very cautious in how optimistic they would be. And then others would say, "Oh, I'm not worried. I think you're going to make it. It's going to be great." Right. So we kind of had to take the top and the bottom and find that healthy balance in the middle. But so much enthusiasm, energy, and just
What would be an
positive.
example of that? Tell me a story. What would be an example of such enthusiasm that you talk about?
Every week they would write a certificate, they would print it out. It says, "Congrats, you made it to 24 weeks." And all the nurses would sign it. "You got this." We'd hang them on the door and we'd have a big outline of those. Other times there'd be instances where we would be in what we felt like was a shaky situation, but the nurses had seen it so many times. Very calming. Just, "Hey, we see this all the time. Don't worry. We've got you. It's going to be okay. Just breathe." And then to take it a step further, when your water breaks, that sac most of the time does not reseal. So as your body keeps making that fluid, it keeps leaking out, almost like your water breaks over and over again. And there would be some times where that would happen to my wife, and it would create a large mess, whether it be on the floor as we try to get her to the bathroom or in the bed or whatever else. And we would be scared because every time you know that your baby's fluid is now leaked out and they're not getting what they need to further their lung development, it's incredibly scary and challenging. But again, that positive energy and encouragement from those nurses was so important because they'd say, we see this all the time. I'm not worried. It doesn't have any blood in it. And they would kind of point out things that they've seen that we could use as reference points to give us that, calm peace of mind, even though it was something that was so scary. I mean, every single time it happened, you're scared. You feel like, wow, is this going to be the day that my wife goes into labor spontaneously? And every single day, going back to those certificates, we would have a board that would say 26 weeks and 2 days. And the first thing we do every day was erase the 2 days and write 3. And I've never been in a situation where every single day I was so grateful just to get through a day, because we get caught up in our day-to-day, process and habits. But that was really a time where every single day was important and we celebrated every single day. And the nurses kind of were very enthusiastic about that too. 31-3. Wow, you guys are killing it. You're past 30 weeks. You're going to, so it was that energy every day, that really helped us keep our eye on the prize, because you realize you have no control. And it's just about your belief, I believe, at the end of the day, that can keep that positive energy.
We're talking to Vince Baiera. He is a nurse and healthcare executive. His Kevin MD article is titled Care Coordination for Obstetrics Teams is Crucial. Vince, what are some of your take-home messages that you want to share with the Kevin MD audience?
I think your attitude controls so much of how you respond to scenarios. And I think some of the beliefs that you'll put out into the universe, they have a funny way of coming back. And I'll give you an example. Through the process, because Sharp Mary Birch Learning Facility, their NICU team would want to do studies. So for babies born between 26 and 28 weeks, we enroll them in this study and we deliver care treatment a certain way, and then we're going to measure it over years and write a paper, etc. They would come to us and ask us, hey, just in case you go into labor on this day, are you willing to participate in this study? And we told them, it's nothing personal. We know you guys are doing great work, but we can't sign that paper because we're putting out into the universe that there's a chance that the babies could come between these weeks. And they asked us about 3 different times for 3 different studies. And there was something about our belief that we didn't want to give a shred or an ounce of energy to the fact that those boys might come early, because we knew every day that they were, gestating, that they had a better chance of that long-term outcome. So just our belief, and as a patient in a stressful situation, you can only control so much. And so really leaning on your belief, really controlling your attitude and your thoughts are going to help influence the outcome. And for anybody who's on the other side as a provider, being positive to those patients, really trying to build them up, because they're going through something that's probably the most scary thing they've ever went through. And so you've got the opportunity to be the light or the bridge, right, to get them hopefully to that outcome that we all want. And so from the patient side, having that belief, from the provider side, really being the bridge and having that positive energy, leaving your stuff at home and focusing on their stuff, right, to help them get further, is just something that we're, forever grateful for the staff that was there. And again, the message that we try to propel to others. So those would be the things that I think most of the staff listening and folks could probably continue to get better at and remember day in and day out.
Vince, thank you so much for sharing your story, time, and insight. And thanks again for being on the show.
You got it. Thanks for having me.